your leukemia class is known as your blood cancer. It is characterized class by increased young cells. Increased young cells in the circulation. Now, itong young cells na to, these young cells are called your blasts. You would have increased blasts. Then, depending on the type of leukemia, depende sa klase ng leukemia class, depending on the type of leukemia, you would have increased blasts on different cell line. Remember, di ba class, ang mga WBCs nyo would have different cell lines. May granulocytic, may agranulocytic, then each corresponding cell has their own corresponding blast. So again, your leukemia is also known as your blood cancer. It is characterized by increased young cells in the circulation. There would be increased blasts. Yun yung tawag nyo sa young cells na yon. Then depending on the type of leukemia, there would be increased blasts on different cell lines. Now, your leukemia class are neoplastic-related disorders. You have your tumor-related disorders. You have your leukemias and leukemoid reaction. We have your myeloproliferative disorders. We have your lymphoproliferative disorders. You also have your plasma dyscrasias and lymphoreticular malignancies associated with abnormal immunoglobulin synthesis. Okay, let's talk about your leukemia. So your leukemia class versus your leukemoid reaction. Now, when you say leukemoid reaction class, this is your false leukemia. In leukemoid reaction, you would have increased blasts. Not due to neoplasm or cancer, but due to infection. So yan yung, while your leukemia naman would have increased blasts due to bone marrow abnormality. Again, kapag leukemia, you would have increased blast due to bone marrow abnormality. Kapag leukemoid reaction, this is a false leukemia. You have increased blast due to infection, specifically severe infections. Then we have myeloproliferative and lymphoproliferative. To simplify this class, your myeloproliferative would involve your granular WBCs. Yung mga neutron nyo, yung mga AO, yung mga baso. While your lympho would involve your lymphocytic, your lymphocytes. WBC. Then we have here plasma cell dyscrasia. Now, whenever you would hear the word dyscrasia class, this would refer to abnormality. And here we have your plasma cell abnormality. Basically, kapag ang plasma cell nyo is abnormal, remember the function of your plasma cell is to produce antibodies. And when you have plasma cell dyscrasia, you would have abnormal production of antibodies. Then there's another cause. We have your lymphoreticular malignancies. Now, when you say lymphoreticular, this would involve the lymph nodes, wherein there would be increased reticulum, or when you say reticulum, there would be increased reticulum or increased tumor in lymph nodes. which would lead to abnormal immunoglobulin synthesis. Again, in plasma cell dyscrasia meaning abnormality, there is abnormal plasma cell. And when there is abnormal plasma cell, there is abnormal production of antibodies. In lymphoreticular malignancies, we have your lymph nodes to have abnormal tumors. That would lead to abnormal immunoglobulin production. Basically, class, your leukemia is a generalized neoplastic proliferation. So when you say neoplastic, this is tumor related. You would have abnormal cell production or the accumulation of leukopoietic cells with or without involvement of the peripheral blood. Basically, class, this is increased young cells in either the bone marrow or peripheral blood. Again, your leukemia is a generalized neoplastic proliferation. It means it is a tumor-related abnormal cell production. And it is also the accumulation of leukopoietic cells with or without the involvement of peripheral blood. Meaning there is increased young cells, specifically the blasts, in either the bone marrow or the peripheral blood. It is characterized by leukocytosis. When I say leukocytosis, increase ang WBC count nyo. Abnormal circulating cells, you could see, normally class, ang blast nyo would only be found in the bone marrow. But in this time, in leukemia, you would have blasts in the peripheral blood. And infiltration of non-hematopoietic tissues. You would be able to see blasts or cancer cells, blasts or young cells or cancer cells in different organs that are frequently but not invariably present. Again, leukemia is characterized by leukocytosis, increased WBC, abnormal circulating cells, which is the blasts in the peripheral blood. Normally, blasts or young WBCs can only be found in the bone marrow. And there would be infiltration of non-hematopoietic tissues. You could see the blasts in different body tissues aside from the bone marrow, which are frequently but not invariably present. Okay, here's the laboratory profile of your leukemia. Now, 90% of leukemia patients develop anemia. So aside from increased blasts, they would have decreased RBC, decreased hemoglobin, decreased hematocrit. Then 50% of leukemic patients have leukocytosis. But it does not go above 100 times 10 raised to the 9 per liter. Again, 90% of leukemic patients develop anemia. 50% of leukemic patients have elevated WBCs, but hindi siya sumusobra class ng 100,000 cubic mm na WBC count or 100 times 10 raised to the 9 per liter. There is also the thrombocytopenia. Decrease ang platelets class. Decrease platelets in 80% of cases. Basophilia in the peripheral blood and bone marrow. So when you say basophilia, it is characterized also by increased young cells or increased cells with nucleus. Then there is also immature precursor or blast cells in the peripheral blood and bone marrow. There is also the presence of reticulocytes, may retics class. Decrease in the LAP level and elevated serum uric acid, lactate dehydrogenase, and vitamin B12. So this is your laboratory profile for leukemia. You have anemia in 90% of patients, leukocytosis in 50%, thrombocytopenia in 80%, basophilia in the peripheral blood and the bone marrow, immature precursor cells or blast cells in the peripheral blood as well as in the bone marrow, and nucleated RBCs or uretics in the peripheral blood. Then you also have a decrease in the LAP level and elevated serum uric acid, lactate dehydrogenase, and vitamin B12. Okay, let's talk about the classification of leukemia. Now we have the chronologic, which is based on natural history. There are three types. We have acute, subacute, and chronic leukemia. Now, acute leukemia class is refractory to remission. When I say refractory, it is possible to remission. And when I say remission, this would refer to returning of the disease after treatment. Let's say ako class, nagkaroon ako ng stomach cancer. I underwent treatment. After a few days, it would remit. Now that is a type of acute cancer. In this case, class, acute leukemia. After treatment with leukemia, it is possible na bumalik yung disease. Acute leukemia class is fatal within 3 months and is characterized by a bone marrow packed with primitive cells. Itong mga primitive cells nyo class, this would refer to your young cells. Kaya yung mga bata na may acute leukemia class, kids with acute leukemia would often die, very fatal within 3 months. Then we have your subacute leukemia. Longer patient survival of 3 to 12 months has the same clinical picture as your acute leukemia. Then we also have your chronic leukemia, which is survival of greater than 1 year if no remission occurs. Blasts are elevated in marrow and blood, and maturation within a cell line would occur. So your blasts would develop into mature cells in a chronic leukemia. So again, acute leukemia, refractory to remission, fatal within 3 months. Bone marrow is packed with your young cells or primitive cells. Subacute, longer survival, 3 to 12 months, has the same clinical picture as acute leukemia. And lastly, chronic leukemia, survival of greater than 1 year if no remission occurs. Blasts are elevated, maturation within a cell line would occur. Now let's talk about the cytologic based on the predominant cell type. So if you recall in your lesson, in your hematopoiesis class, we discussed the different cell lines. So the first one would be your granulocytic or myelocytic. It would involve granulocytes and their precursors. We have under that acute myeloid or acute myeloblastic leukemia. Myeloblasts are predominant. We have your chronic myeloid, chronic granulocytic, or chronic myelogenous leukemia. In this type class, itong CML nyo. This is your AML. And then this is your CML. Sa CML class, predominant ang myelocytes, neutrophils, metamyelocytes, and a few myeloblasts. Again, in your AML or acute myeloid leukemia, myeloblasts ang madami. In your CML, myelocytes, metamyelocytes, and neutrophils are predominant, but there are few myeloblasts. Another one would be your pro-myelocytic. You would have the presence of a typical pro-myelocytes. And then another one would be your myelomonocytic. In myelomonocytic class, myeloblasts are numerous and abnormal proliferation is evident. Myelomonocytic. And then another one would be your erythroleukemia, or so known as your de Guglielmo syndrome. Now, this has abnormal proliferation of both erythroid precursor and granulocytic precursor. And the last one would be your eosinophilic leukemia, which is characterized by the predominance of eosinophilic immature myeloid cells. Again, pag AML, myeloblast ang madami. Kapag CML, myelocyte, metamyelocyte, and neutrophils ang madami. Promyelocytic leukemia, we have your atypical promyelocytes. Myelomonocytic, myeloblasts are numerous, as well as abnormal proliferation in developing granulocytes as well as monocytes. Kapag erythroleukemia or de Guglielmo, both erythroid and granulocytic precursor. And your eosinophilic, we have your eosinophilic immature myeloid cells. So this is an example class of your AML sa taas and sa baba ang inyong CML. So here we have myeloblasts. Then here we have your pro-myelocyte, and your meta-myelocyte. Now, sir, paano ba namin yan ma-identify sa laboratory? No, you will not be the one identifying this class. Ang mag-identify nito is your pathologies. What you're going to do lang is that you're going to report, magre-report lang kayo ng abnormal cells na nakita nyo. But the final reading would be done by the pathologists. So let's say nag-work na kayo, you have your internship, you're working na, you were asked to perform blood smear. May CBC kayo. Your CBC showed high elevated WBC count. Upon smear examination, nakakita kayo ng mga cells na malalaki ang nucleus. They are blasts in appearance. Ang gagawin nyo, class, you're going to refer this to your pathologist. And your pathologist would be the one giving the final result. Another one, after your granulocytic, we have your lymphocytic or lymphoid. Now, this would involve lymphocytes and their precursors. So kanina, granulocytic tayo. Let's talk about your lymphocytic. Now, we have your acute lymphoid and acute lymphoblastic, or also known as your acute lymphocytic leukemia. This is known class as your ALL. Now, in your ALL class, kanina, myeloblast ang madami sa AML. This time, you have the predominance of lymphoblasts. Then, we also have your CLL, or your chronic lymphoid leukemia, or chronic lymphocytic leukemia, predominance of small and mature lymphoid cells. Again, for your lymphocytic or lymphoid, we have your lymphocytes and their precursors. The first one is your ALL, which is characterized by the predominance of lymphoblasts. And we also have your CLL, which is characterized by the predominance of small and mature lymphoid cells. So this is your CLL class. Notice the basophilia on the cytoplasm. So basophilic cells. Let's now proceed to the monocytic series naman. So after your granulocytic, your lymphocytic, we have now your monocytic. It involves monocyte and their precursors. The first one would be your acute monocytic. In acute monocytic class, madami kayong pro-monocytes and monoblasts. You have two types of acute monocytic, the Schilling type and the Naegeli type. Now, yung Schilling type nyo class, you have pure monocytic leukemia with monocytes derived from the MPS. MPS is your macrophage phagocytic system with no evidence of abnormal granulocyte development. While your Naegeli naman is same as your myelomonocytic leukemia. Yung Schilling type nyo class, this is basically involves tissue macrophages. They would have increased macrophages. While your monocytic would be the same as myelomonocytic. So let's go back at the myelomonocytic. Now, myeloblasts are numerous. So here, class, in your Naegeli type, you have increased monoblasts and increased monocytes. So this is your acute monocytic leukemia. This would be your monoblasts. Then let's talk about the functional capacity of release mechanism. So there are three types class. We have your leukemia. This is characterized by the presence of immature or abnormal cells in the peripheral blood and with WBC greater than 15,000 per unit. Then we have your subleukemic. Ang tatandaan nyo lang dito class, they have different WBC counts. There is the presence of immature abnormal cells with WBC count less than 15,000 units. Kapag leukemic class greater than 15,000 per UL na WBC count niya, merong immature and abnormal. Kapag subleukemic less than 15,000 per UL na WBC count with abnormal cells. While your allochemic leukemia, no immature cells in the peripheral blood, and with WBC count less than 50,000. So you have mature cells lang dito. Walang immature walang blasts. No blasts in the peripheral blood. Then we have localized proliferation of cells at the same time. So we have your chloroma. Now, this is a type of myeloblastic leukemia where there is formation of tumors originating from the periosteum. So, yung mga periosteum nyo would involve the skulls, the orbits, yung sa mata nyo, yung bone, nasal sinuses, ribs, and vertebrae. Upon histological examination, tumor would show a green color of myeloblasts and contains large amount of peroxidase and protoporphyrin. So, yung chloroma nyo class is a myeloblastic leukemia that would affect the periosteum, yung skull nyo, yung orbit. So this is the appearance. So it would have here, it would affect the orbit of the eye. It could also affect the skull. And this is their green pigment. So sabi kanina, it would have a green pigment. Now this is an example of a section, histological section of tumors sa orbit bone. And if you notice, it would have a green pigment. That is your chloroma. Then we also have your myeloblastic sarcoba. Now, this is a localized tumor of myeloblasts, which differs from chloroma by the absence of pigment. So your sarcoma class would have no green pigment. So if you're going to be asked, what's the difference between chloroma and sarcoma? Yung chloroma nyo, may green pigment yung tumor. Si sarcoma, walang green pigment. So here's your myeloblastic sarcoma class. No vein pigment in the tumor. Parang kakaawa nun pag may ganyan ka. All the faces to have cancer sa mukha pa. Sa eyes, yung mga facial ano. Then you also have your myeloma. So you would have local tumorous proliferation of plasma cells in the bone marrow. So in a type of myeloma class is your multiple myeloma, wherein plasma cell neoplasm associated with substantial morbidity and mortality. Now, in your multiple myeloma class, you would have increased abnormal plasma cells. Ito yung sinasabi ko kanina na plasma cell dyscrasia. You would have increased abnormal plasma cells. And when you have increased abnormal plasma cells, it is expected to have increased abnormal antibodies. Kapag abnormal ang source ng immunoglobulins nyo, expect nyo rin na abnormal ang inyong antibodies. That is your myeloma. So these are example class of your plasma cells. Pag tinignan nyo sila, if you're gonna look at it, isa-isa nyo yung mga pictures, masasabi nyo, sure, wala masyado silang difference. Yes, kasi nga, that's the reason why pathologists are the one reading this. Kasi pathologists are trained to identify the cell type. Kasi tayo pag tinignan natin yun, ito ano to. Basta cancer cell to, blast to, ganun na lang tayo. But if you want to study them, you're gonna review a lot of pictures class, a lot of characteristics if you're going to become a pathologist. Pag nag-med school kayo, those who plan on taking med school, and I know you will be successful in that, just be ready to take a lot of information, lalo na sa mga ganito. You'll be asked to memorize a lot of appearances, morphological and microscopic appearances of cells. Then we also have your lymphoma. Now, your lymphoma class is the one I was talking about earlier, yung lymphocytic reticular tissue. It would begin and involve lymph nodes to other sites such as the spleen and the GAT. So this time you would have increased lymphoblasts. And then they would have increased increased lymphoblasts. Now, this is a cancer in the immune system. It would develop in the lymph nodes and would spread to the spleen and the GI. So, ito yung lymphocytes, yung lymphoma. So, you would have abnormal proliferation sa mga lymph nodes. And when there is abnormal proliferation sa lymph nodes na class, there would be abnormal filtration. Remember, ang purpose ng lymph nodes niya is for filtration, diba? So that ends our